You've done the PSA test and your PSA is high. Is it cancer or could it be something else? Welcome to Talking with Docs. I'm Dr. Paul Zalzal.
I'm Dr. Brad Wiening. We have a guest today, Dr. Peter Ince, urologist, and he's going to talk to us all about the top 10 causes of a falsely elevated PSA test.
That's the prostate-specific antigen.
So if your PSA is up, there's a lot of things that make it go up besides cancer.
Thankfully.
And that's what we're going to talk about. So in general, anything that squishes your prostate can make PSA come out into your bloodstream.
Right.
Or anything that inflames your prostate can make PSA leak out.
Because this is where it's made, in our prostate.
It's made in the prostate.
Yeah.
And if that leaks into the blood, your PSA goes up, not because of cancer, but because of these other reasons. So we're going to go through the top 10 reasons your PSA could be elevated besides prostate cancer.
Okay, and we order a PSA to try and detect prostate cancer, but these are things that may give you a false positive.
Okay, so number one is BPH. We use lots of letters and short forms. Benign prostatic hypertrophy. So as men age, their prostate can grow, and then when it grows, this can lead to increased PSA measurement.
So if you have a little prostate and a higher PSA, that's more concerning than if you have a big prostate, which is not a sign of cancer. An enlarged big prostate is what happens to men, is a lot of men when they get older. The prostate enlarges, PSA can go up because of that.
Well, why are you looking at me when you say get older?
Because you look older than him.
Really?
You are a little bit older than me.
No, he's going to hang on to that. He's going to hang on to that.
And I think I read that urologists are actually using this so that you can use ultrasound or MRI technology to measure the size of your prostate and then correlate that with the measurement on your test.
Yes, PSA density.
Oh, PSA density.
Number two.
Okay, number two.
Prostatitis, okay, inflammation of the prostate. Anytime something is inflamed, we don't say you have an inflamed X, we say we just had itis at the end of it. So prostatitis, inflammation of the prostate.
What is this and why do we get it, Pete? What's prostatitis?
Well, it's sort of like the way you get bladder infections. You can also get infections of any part of your body. Prostate can get infected, and that can make your PSA go up.
Okay.
So
number three.
Number three, recent ejaculation. So a lot of people don't know that the prostate-specific antigen is actually used to make the semen thinner so that they can get through the seminal fluid easier to the egg.
It's easier to swim in liquid than in a hard gel.
There you go. So if you, Pete, how long do you say, if someone's having a PSA test, how long should they not ejaculate for to make the test more accurate?
I would say 2 days.
Okay.
Can you handle that?
There you go.
Number four, urinary tract infections. We talked about this, inflammation, infection. So anywhere in the urinary tract that's infected, that could trigger PSA elevation.
And I want to add one more thing.
Okay.
When you do your PSA, if you have any inflammation in your body,
Oh.
it can also affect it. So I've had people who've had COVID, who've had like a flare-up of their arthritis. Any big inflammatory change can make your PSA go up.
Okay.
COVID of the prostate.
Okay, so that's number four. So number five is a recent prostate biopsy. So like Dr. Ince said, if there's any trauma or squishing of the prostate, and that would include putting a needle inside of your prostate, that can make your numbers go up. Would it not be sensible then to just maybe not do the test if you've had a
Absolutely.
It seems unnecessary. Don't do the test.
do a PSA test if you've had any of these top 10 things recently.
How long do you wait after a biopsy before the first test becomes useful?
Well, the biopsy is the
Because
most
of the test,
useful
right?
test.
Yeah.
So that'll tell you what's going on.
Okay.
And then determine when you should do your next one.
Okay, and along the lines of prostate biopsy, any prostate surgery, because that's just
pretty
gonna
obvious.
You're poking the bear.
Okay, number seven, not along the same lines, cycling can actually make your PSA go up. So I guess the pressure on your perineum from those tiny little narrow seats.
Those are the
you're
worst.
a cyclist, aren't you, Pete? You like to cycle?
Back in the day.
Okay, not as much anymore?
No.
Too hard on your prostate.
No, I'm lazy.
Okay, so cycling. So same thing, would you say 2 days for no cycling for the test, or?
It could be longer. There's a lot of guys who are avid cyclers,
Yep.
and I'm talking about the narrow seats.
Yeah.
If you have one of the broad seats where your weight's on your tush and not right in the middle,
Right.
it doesn't affect it. But there's a lot of guys who are avid cyclers, use the narrow seats.
Yep.
It can make your PSA, they literally have to stop biking for a month.
Because those seats are one step away from the digital rectal exam, aren't they?
Yes, exactly.
You look very uncomfortable. Okay, number 8.
There are medications that can cause it. Alpha reductase inhibitors is a class of medications. Certain medications can make your PSA go up. Is that right?
Actually down.
They make it go down.
Fooled you.
Down.
So alpha reductase shrinks the prostate,
Okay.
and it actually can falsely make your PSA go down. So
man.
if you are on
That's a false
Avodart
negative?
or Proscar, one of those medications, you have to double your PSA
Oh, okay.
after being on it
interesting.
for a year to know what your true PSA is. So
thought
that
those
actually can
medications can
falsely
go up.
decrease it.
Number 9. So number 9 is age.
Yes.
But we know that PSA goes up with age. So, but can it be falsely elevated, or because of your age, it just goes up with age, right?
In general, as you get older, the PSA will gradually go up. Now that is partially a result as you get older, your prostate also keeps enlarging.
Right.
Just like some
Your
people, their
ears-
noses or ears keep growing.
Here's no prostate. Okay, last one.
It's a funny looking clown.
That's right.
Number 10.
Okay.
Hormone replacement or hormone therapy, testosterone, for example.
Yes.
I'm not talking about if you have decreased testosterone and you're trying to get it back to normal. But like if you have a normal testosterone and you're on testosterone, can that increase your PSA?
Yes.
Thank you.
So probably because that stimulation can also make your prostate grow.
Ooh, so it's kind of tied into that BPH.
Yeah. And so did we do top 10?
That was number
top
10.
10.
What I was going to say, so then people that are on hormone replacement actually have to be followed maybe a little more carefully with their
Yes.
PSAs for the risk of prostate cancer.
Exactly.
Back in the day, they thought, hey, this really is directly linked. It's a little more nuanced now. Is that fair to say that the link between testosterone replacement and prostate cancer is not as direct as we once thought?
Yes, if you're taking testosterone replacement because you are normally have a abnormally low level,
Right.
and you're bringing it up to normal,
Right.
that is not believed to have an increase your risk of having prostate cancer.
Right, but if you're normal and you're going super physiologic, like a lot of middle-aged men who are maybe saying, listen, I want to get more muscular, I want to be stronger, I want to be more fit, I want to have a...
Definitely keep an eye on, get a rectal exam and a PSA on a regular basis.
Okay. Now you know the top 10 reasons that your PSA test might not be accurate. Usually, we're talking about falsely elevated, but sometimes falsely reduced. If you like this video, please like it, subscribe to our channel, share it with someone that's having a PSA test.
And you can watch our video on PSA just to realize how confusing a topic PSA is and how it is a screening test, but it's not a perfect screening test.
There you go.
Thank you
But
so much.
don't ignore it.
Don't ignore it.
Do not ignore it. Fair enough. Don't ignore any of the stuff we talk about in video now, except for that.
Yeah.
All right. You are in charge of your own health.
And thanks to Dr. Ince for joining us again. We'll see you next time.
Take care.